Good morning, good afternoon, good evening, and good night, depending from where you are watching and listening to me around the globe. I am Mbonu U.S. By vocation, I'm a Catholic priest. By profession, I'm a licensed clinical psychologist. In my YouTube therapeutic series on conquering bad habits, today I want to talk about trauma and post-traumatic stress disorder, how to deal with it. So, what is trauma? The word trauma is a Greek word that etymologically means shock, injury, or wound. So, what is trauma? Trauma is an emotional or mental bodily response to a terrible, a distressing, a frightening, a life threatening activity or event that has happened in someone's life. So, trauma is not a thing, it's not a person, it's not an event, it is just an emotional, bodily, mental response to distressing, terrible, bizarre, harrowing, and life-threatening events or activities. Okay, trauma can be grouped into two: minor traumas and major traumas. Minor traumas are the ones that we experience or we have experienced once in our lifetime. Maybe in the family, from parents, from siblings, from relations, or in school, or in different places, but it comes and it goes. It does not have a lasting effect. But major traumas are the ones that we have experienced. They have lasting effect or impact and remain in our conscious and even unconscious part or subconscious part of our brain. These major traumas can be grouped or divided into three types: the acute trauma, the complex trauma, and the secondary or vicarious trauma. So the acute trauma is a mental or emotional response towards a distressing event that has happened but it has a lasting impact in the brain or in the mind. Then what is a complex trauma? It is an emotional response to a distressing or frightening or harrowing event, but it is repetitive and it has a lasting impact in the mind or the brain. Then what is a secondary or vicarious trauma? It is emotional response to an event that is distressing, harrowing, that has happened to someone, not to you, not to me, but someone else, but you witnessed it. For instance, you saw where armed robbers were robbing, even killed someone, or where someone was kidnapped, or where someone had an accident and died. You witness it. So it is a secondary or vicarious trauma. So, what are the causes of trauma? There are many causes of trauma. Any event or a occasion or an occurrence that is harrowing, frightening, distressing, life-threatening to you causes trauma. It can be childbirth for those who give birth. It can be sexual abuse or domestic abuse or natural disasters. It can also be war or genocide or mass killing. It can also be kidnapping or accident or armed robbing. Anything that is life-threatening, distressing, harrowing, it can cause trauma. Then what are the signs or symptoms that you are traumatized or that you have trauma? Nightmares that will come to you. Then emotional outbursts, lack of trust, mood swing, when you have morbid fear, restlessness in you, you can even have what is called insomnia, sleeping disorder, that you cannot control yourself. You cannot be in good relationship because you are traumatized. People are traumatized in the environment where they live, even in the Western world, even in the developed world, in the developing world, they are traumatized. These are signs that you are traumatized. Then what are the effects of trauma? Effects of trauma, they are mental illnesses, just like anxiety disorder, even personality disorder like borderline personality disorder, dissociative disorder, depressive disorder. Then among all these disorders, the last effect of trauma is what is called post-traumatic stress disorder. I would like to dwell on this. So what is post-traumatic stress disorder? It is a trauma that has been caused by stress, chronic stress, destructive stress, negative stress, and it has a lasting effect on the individual. A recurrence, it repeats, it remains there. It is called post. After the trauma, then it has come to dominate the individual. There are many people in their life, they have not been traumatized. They even traumatize others. Many people who fall into post-traumatic disorder, they lack resilience. But those who have a high frequency or level of resilience, they hardly fall into this disorder called post-traumatic stress disorder. So what are the symptoms of post-traumatic stress disorder? Unprecedented flashbacks. You have flashbacks of the thing that happened, and when you have it, you are shocked. You are shocked. You can quake. You can scream. You have anxiety. You have fears. You have bad memories about all these things. Although you can apply avoidance and withdrawal method, but still it will be coming. It will be repeating. It will be flashing back. Okay. Having said all this, the question is, can post-traumatic stress disorder be cured? Yes. You can do the diagnosis. You have this book, Diagnosis Statistical Manual, the 5th edition of mental disorders. In page 171, you can see the diagnostic criteria for you to diagnose post-traumatic stress disorder. So the treatment you can give after a good prognosis is cognitive behavioral therapy. So a therapist, psychotherapist can handle it. What does that mean? Your thought patterns that are negative, that are traumatic should be changed. Because the way you think determines the way you feel. And the way you feel determines the way you act. If you think negatively, your feelings will be negative. And it will affect your behavior. So a good psychotherapist will help you to work on that. Then another method that you can use is what is called EMDR. Eye movement desensitization reprocessing. So a good therapist can handle it. You will relieve your traumatic experiences and he or she will be directing your eye movement to help you to focus and relocate from the stage of trauma to a stage of freedom and healing through this therapeutic method. Another method that you can use is what is called medication. You can apply yoga. You can apply autogenous training. You can apply what is called mindfulness. This can help you to come out from trauma. Another thing that you can practice what is called self-care. No selfishness or selflessness, but self-care, taking care of yourself. You apply a good healthy lifestyle. Avoid smoking, avoid alcoholism, avoid negative lifestyle, avoid traumatic events or stressful events or stressors. Have a good sleep, rest, Eat good diet, exercise, at least 30 minutes a day. You can go to gym, you can jog, you can walk, do any exercise that you like. Then another method that you can apply for you if you are having symptoms of anxiety or fear or depressive mood, you can meet your doctor, he can give you some antidepressant that you will combine it with this psychotherapeutic method. Then try to get involved in social groups, in cultural groups, even in spiritual groups, and engage in some spiritual activities. All these things will help you to come out from post-traumatic stress disorder. But a caveat, it cannot be healed automatically. Some have lived with trauma all through their life. They have been traumatized all through their life. What happened to them when they were children or in childhood, like sexual abuse and all those things, they are recorded. But when you follow your therapist and cooperate with him or her and with the medication, I believe you will come out from trauma. Okay, in my next video, people have called me, they have sent me messages, they asked me to do a video on mental health and mental illnesses. I will handle that in my next video. You can like this video, you can share, you can subscribe, and you can comment so that it reach to people who really need help. You can contact me through my email that you see on the screen, mbonugon@yahoo.com or mbonugon@gmail.com. God loves you and so do I. Thanks for listening and watching. Bye.